Have you ever heard of nanotechnology? If not, let's get started from the beginning. The Greek word nanos means a dwarf, so in general terms, nanotechnology means technology that has to do with small things. In science, nano also means a billionth. For example, a nanometer is a billionth of a meter. To make things more visual, a marble is a billionth in size when compared to the size of the Earth. Hence, nanotechnology is science, engineering, and technology conducted at the nanoscale. The ideas and concepts of nanotechnology started in 1959 when physicist Richard Feynman gave the talk "There's Plenty of Room at the Bottom" at the California Institute of Technology. He described processes where scientists could manipulate individual atoms and molecules. A decade later, through his work in ultra-precision machining, Professor Norio Taniguchi coined the term nanotechnology. But it wasn't until 1981, when the scanning tunneling microscope was developed that allowed scientists to see individual atoms, that nanotechnology began. Nanotechnology involves the ability to see and control individual atoms and molecules. Everything around us is made up of atoms: the food we eat, our bodies, the clothes we wear, and the air we breathe. Hence, nanotechnology can be used in various areas of our day-to-day life. For example, the UV protection layer in our glasses is made out of nanoscale films. Nanoscale titanium dioxide or zinc oxide have been used in sunscreens for years and protect us from the sun while appearing invisible on the skin. The uses of nanotechnology range from very basic day-to-day needs to major life-changing therapeutics. We've briefly described how it's used in our day-to-day life, so now let's take a look at some major implications of nanotechnology in the field of medicine. When nanotechnology is applied in the field of medicine, it is often referred to as nanomedicine or nanotechnology-enabled medicine. Within the field of medicine, nanotechnology has shown promise in the areas of diagnostics and treatment for a variety of conditions and has the potential to be more advantageous than conventional techniques. Let's take a closer look at such applications in cancer research and COVID-19 vaccines. When it comes to imaging practices to detect cancer, the current technologies can really only detect when a visible change to the tissues has occurred, at which point thousands of cells have already multiplied and may be metastasized. Additionally, current imaging technologies can really only identify the presence of a cancer, but identifying the characteristics of the disease, including the nature of the tumor, requires biopsies. These are the two shortcomings that nanotechnology has the potential to address. Antibodies which bind to receptors commonly found on cancer cells can be coated onto nanoparticles, which can be detected using diagnostic imaging technologies such as MRI and CT scans. Furthermore, this concept can be applied to various molecular markers, which means specific stages and types of cancer could be identified using nanotechnology. Aside from its applications in diagnosing cancer, there are many applications for nanotechnology when it comes to cancer treatment, one of which includes the use of nanoparticles as drug delivery systems. Conventional cancer treatment methods often include chemotherapy, which involves the use of medications which kill the cancer cells. However, there are several issues with chemotherapy. One is that it can lead to adverse side effects as these medications kill both the cancer cells and healthy cells. Nanoparticles have the potential to more effectively target only the cancer cells and therefore minimize the harms. Furthermore, the specific size of the nanoparticles, which range from 10 to 100 nanometers, allows them to be large enough to prevent vascular leakage, while small enough to avoid immune detection. In other words, the drugs which the nanoparticles are delivering are more likely to reach their target cell, the cancer, and spare the healthy cells in the body. Finally, one more example of the use of nanotechnology in medicine includes the recent COVID-19 mRNA vaccines by Pfizer and Moderna. Nanoparticles, lipid nanoparticles in specific, are used in both of these vaccines to counteract two of the main challenges when it comes to delivering mRNA. The first challenge posed by utilizing mRNA is that there are many RNA-degrading enzymes in the body which could destroy the mRNA. To counteract this, both the Pfizer and Moderna vaccines encapsulate the mRNA with lipid nanoparticles as a barrier to protect the mRNA. Additionally, because our cells are surrounded by membranes which are negatively charged, it is difficult for the negatively charged mRNA to cross this barrier. This is where nanoparticles come in hand as they facilitate the transport of mRNA into its target cells. These are just a few examples of the applications and advantages of nanotechnology in medicine. Let's take a look at some of the new, exciting developments in this field currently undergoing research. First, nanotechnology has been considered a tool for medically assisted reproduction. Though assisted reproductive technology already helps with cases related to infertility, we're still presented with challenges such as ovary stimulation, multiple pregnancy, and genetic disorders. Nanotechnology can help overcome these impairments by improving the quality of mature oocytes, refining genetic screening and diagnosis, and optimizing gene editing. Recent advances in nanomedicine also have the potential to aid the diagnosis and therapy of liver fibrosis. Liver fibrosis is the formation of abnormally large amounts of scar tissue in the liver. This can cause liver failure, liver cirrhosis, and liver cancer. Traditional diagnostic methods and drug-based therapy have several limitations, including the lack of precision and inadequate therapeutic efficiency. Nanomedicine enhances imaging contrast and improves tissue penetration and cellular internalization, also called endocytosis. Finally, nanomedicine is proving to be a powerful tool in treating strokes. According to recent and promising developments, nanomedicine can enhance breakdown of clots known as thrombolysis in ischemic stroke, limit bleeding in hemorrhagic stroke, reduce neuronal death, and improve the overall prognosis of stroke. Overall, not only can nanomedicine help with the diagnosis and treatment of cancer, but there are many other exciting developments in the field of nanomedicine. We have seen some examples in our everyday lives, such as with the recent COVID-19 vaccines. Ultimately, nanomedicine has the potential to provide advantageous alternatives when compared to conventional therapies and offer personalized treatments.